cost. We are now recording, and so the link to the recording will be available later today and in the next issue of My Alliance for Brain Health. If you need closed captioning, there is a feature at the bottom of your screen for the Zoom people that you can use. If you need closed captioning in the room, I'm sorry, we don't have that capability, but we'll do our best to make things clear. And those of you again in the room, feel free to get some snacks. And to the person who asked if I could teleport the snacks through the internet, we'll have to get a research project for that. Maybe we'll find some PhD that needs a project. In the meantime, eat your own snacks and enjoy the brain health information that Dr. Andes will bring to us. And so, Dr. Andes, I'll ask you to come here and speak through the mic. It's not the most elegant setup, but we do want to be able to hear you. So, and the people on Zoom want to be able to see you. So if you would take my place at the mic, I'll turn it over to you. It's a little too loud. Have I ever been accused of that before? Okay. Yes. I don't know. I will quit talking. That solves that problem. And then Dr. Andes, maybe you don't have to stand as close to the mic as I am. Thank you, Karen, for keeping me on track. All right. So here comes Dr. Elizabeth Andes. Thank you so much.
Well, good afternoon. How's everybody? And if anybody I did pass out, or this nice lady in the striped dress passed out a handout. And if anybody needs a pen to take notes, I have pens in that plastic bag. Does anybody need a pen? Inevitably, I find I don't have a pen or paper, and I want to take a note, so I provided both today. So anyway, good afternoon. It's just a huge privilege to be here today to talk about dementia. Now, I'm going to move a little bit because is there any way to flip this screen down? I guess there isn't. Okay. Anyway, I'll stand on my tiptoes so you can see over. Okay, good. So I represent, I mean, the Speakers Bureau that I work with is through the Kansas City Medical Society Foundation, but the views that I'm expressing are my own and don't belong to anybody. And also, I'm not being paid, and I don't have any financial incentives to promote products or treatments or anything. All right, cool. Yeah, that's what it's about, right? Okay. So we're going to talk today about normal age-related brain function versus dementia, but we'll also have some discussion about how to have a conversation with someone you think potentially has a problem with their memory, and how to talk with the doctor and family and friends, what caregivers need to know and do, what treatment is currently available. And after my talk, I'm going to be very happy to entertain questions because I find that's the most rewarding part, actually. So the Dalai Lama says, love and compassion are not necessities, are necessities, not luxuries. Without them, humanity cannot survive. Love and compassion. Yep. So what's the difference between normal aging and a disease? There are lots of small changes we all in this room, with your exception, may have noticed as we grow older, like forgetting a name but remembering it later. So misplacing your car keys is normal. Getting lost when driving to a familiar place is not. Forgetting to set the timer when you're cooking is normal, but forgetting to turn off the stove or oven, especially more than once, is not. Usually with age-related mental memory loss, the symptoms don't interfere with normal daily life. And then, unfortunately, with dementia, the changes may start slowly, but with time, they gradually grow worse. And that's a term we use called progression, or it's a progressive disease. So unfortunately, this is one of those. Alzheimer's disease is progressive. Making a list is normal, but not remembering how to do the things on the list isn't. Dementia is a term that talks about the changes in memory, reasoning, judgment, language, and other thinking skills like um, predicting future events. And also, unfortunately, as it progresses, there also may be motor changes, which make walking more difficult, and other like psychiatric type symptoms like agitation, paranoia, and even psychosis. Agitation, I think everybody knows what that means. Paranoia means you are afraid that people are trying to harm you. And psychiatric symptoms that are known as psychosis are things like delusions or hallucinations. Hallucinations where you see and hear things that don't truly exist. And delusions is that you think you're the queen of Scotland or something. Yeah. Like that. Loved ones may think, he's just not there anymore. I wish things would go back to normal. And a patient described this as, my memory was written on a blackboard, but then partially erased. The best rule of thumb is if you're concerned, check it out. Okay. So if you're making an appointment to have your mental status evaluated, it may pay to let the receptionist or the person you're making the appointment know that, because sometimes extra time may need to be allotted. Your doctor will want to take a thorough history of all your health problems and any medications you may take. They may want to know if you have a history of head injury, particularly sports-related repetitive injuries, which, by the way, aren't just for football and boxing. Soccer, basketball, there's a number of other sports that we typically don't think of as head injury sports, but unfortunately, collisions and falls can occur. Um, the history will include any emotional conditions, if you have sleep apnea or symptoms that might suggest sleep apnea. Alcohol and drug use are really important to talk about. And in addition, some tests may be performed, including blood tests like a thyroid and a vitamin B12. Also, imaging may be done. So CT scans or MRIs or PET scans. There's one that's called a SPECT scan. I'm not going to bother with all that. But I want to say that brain tumors or infections, repetitive strokes are all very important things. This microphone is just, it's just really, if you can you hear me if I stand back? I'm going to stand back a little because that blowing is bothering. All right, thank you. Online,
online.
I'm sorry.
We can hear you online still.
Okay, perfect. That was what I wanted to know. Thanks. You guessed correctly. Anyway, there are changes normally in aging that we can see on these scans, including the fact that the brain shrinks in size as we age. That's actually normal, and it doesn't really tell us a whole lot. If you looked at 50 scans that showed brain's shrinkage, you couldn't pick out the 50 who have dementia versus the 50 who don't, just using that modality. There are some radionucleotide tracers that can be given with a PET scan to help show up amyloid in the brain. But even that, even amyloid in the brain, tells us that you have a higher chance of developing Alzheimer's, but it does not make the diagnosis or predict it with accuracy. So there's just not going to be a diagnosis made. However, it can rule out those important things we talked about, like infection or tumor, that sort of thing, strokes. Mood disorders and mental illness must be thoroughly evaluated because what we call pseudo dementia, like PSEUDO, pseudo, is really common in things, particularly depression, but also, golly, I'm going to stand this way. Also, there are some very intense tests that are called neuropsychiatric tests. Those can test memory, cognition, problem-solving skills, spatial awareness, and if indicated, sleep studies could be done and any sleep disorder treated because lack of sleep can make you pretty dull. Yeah, pretty dull. Anyway, so lots of folks may have concerns about a loved one, but don't even know how to start the conversation and fear it. And those of us who may have noticed memory changes may not be prepared to seek a diagnosis because they it's on a I don't want to know basis. But I will say that the sooner the better because there are treatments. And although we don't have treatments to reverse the illness, the treatments that I'm going to describe slow the decline. So the way I would like to put it is, do you want to slow your decline when it's up here, here, or here? And I think we know the answer to that. So medications can be used to treat Alzheimer's. The most common are the cholinesterase inhibitors that prevent the breakdown of acetylcholine in the brain. That can improve. These medicines can improve cognition, your thinking process, and they include Exelon, which is rivastigmine, Aricept, which is donepezil, I love these names, benzgalliamine, which is Zunveil, and galantamine, which is Razidine. There's another medication that's often combined with those, and it's called Namenda or memantine, and it blocks the actions of glutamate. So we think that the disease starts to destroy the brain, and those brain cells called neurons, when they break down, start to release glutamate. And when there's a lot of that in the brain, it is toxic. So this drug helps prevent that. There's a drug called orexin, which is a receptor antagonist. There's one called suvorexant, which is Belsomra, which can help sleep. And then if the behavior changes are very bothersome, if they include agitation, hallucinations, or paranoia, atypical antipsychotics can be used, specifically quetiapine, which is Seroquel, brexpiprazole, which is Rexulti, or clozapine, which is Clozaril. Approved drug called pimavanserin, which is Nuplazid, which is to treat the psychosis, and it's still being evaluated for safety and efficacy. Two drugs that help stop the amyloid. Amyloid is also sort of a waste product that is deposited in the brain. And there's two intravenous drugs that have been introduced to help decrease that. But remember what I said earlier, you can find amyloid in the brain, but it doesn't necessarily, it tells you you're at higher risk, but it doesn't tell you you're going to have it. At any rate, these two drugs are indicated for very early problems called cognitive, I'm sorry, and I should have written it down. I thought I would remember some mild cognitive impairment, I think. Anyway, they're called Kinsula, oh, sorry, I said it wrong, Kinsula, which has been shown to slow progression at 18 months by about 22%. The other one is called pimavanserin or Nuplazid. Oops, nope, that's the one for, okay. The other one is called Leqembi, sorry. And unfortunately, the costs of these are pretty darn high. The Kinsula is about $32,000 a year. Leqembi is about $26,500, and that does not. That's the drug cost. That doesn't include the cost of infusion, because then an IV has to be started, and there are often charges for the medical care associated with that. So these are pretty expensive. Now, if depression's present, we can use the selective serotonin reuptake inhibitors like Prozac and drugs we're very familiar with, Paxil and so on. But all these medicines, even the ones that are designed to treat dementia, need to be started very slowly and monitored very closely, because your results may vary. All right. Over-the-counter medicine, I want to mention too, often poorly interact with these meds and with the condition itself. So I believe everyone who's being treated should definitely check out over-the-counter meds, and that includes vitamins, minerals, and herbal products, even nasal sprays and eye drops. Yes, those can have effects, with your doctor, to be sure it's a safe combination, and also to make sure that it doesn't cause interaction. If sleep is a big problem, it's a good idea to do things to make your sleep better besides drugs, because sleeping pills themselves, unfortunately, have been linked to dementia. So options include increasing your daytime exercise, getting out and exposing yourself to sunlight during sun hours, using blue blockers if you're using a screen such as a computer or a tablet or a TV. Also, it does help to avoid caffeine, have a regular bedtime routine, have a comfortable, cool bed that's dark. The bedroom should have good ventilation. I could go on. Matter of fact, I have a whole talk on how to get a good night's sleep. There's lots of tips and techniques, but at any rate, it really does help to do non-medicinal type treatment. If someone has been diagnosed with a dementia, it really is important to seek medical attention if there's a sudden decline in their mental status, because fever, injuries, urinary tract infections, respiratory infections, constipation, or other illnesses can worsen mental functioning, and that can happen even in folks without dementia. A changing in surroundings or routine can also cause that kind of being thrown off balance. And if a person is having hallucinations or delusions, and you're there, it's such an important thing to address their fears compassionately and redirect their attention. So if somebody says there's kids in the neighborhood peeking in the window, which is not an uncommon delusion, one might say, well, let's pull the drapes so they won't bother you. And the person may have actually been seeing their own reflection in the window, and it can solve that problem by pulling the drapes. But you just don't know. We'll get to this in a minute, but arguing there's nobody out here actually makes matters worse. And it's important not to directly contradict or argue with a person who's having delusions, because they're already stressed and distressed enough. The key for better care and outcomes. Oh, I think this is a good time for one of my quotes, because this is pretty dry, but Booth Tarkington said, cherish all your happy moments. They make a fine cushion for old age. Okay, so the key for better care and outcomes is education and communication. If you're the caregiver or even if you're the patient, read all you can. Learn as much as you can and interact with your healthcare team. Keep all your scheduled appointments, so important. And remember to be kind to yourself and be kind to your caregivers. Enjoy each day as it comes, doing fun activities, attending events. Sharing your diagnosis with other people helps them understand your new reality. And it really, really is important. Remember that nobody asked for this condition, nobody deserves this condition, and no one should be treated poorly because of having this condition. Raising your voice, arguing, or simply ordering someone around is counterproductive. Distraction, calm reassurance, and humor remain the best approach. If you're a caregiver, get help. Use the resources that you can. There are adult daycare places, there's respite care that can give you a break, there's home health. And if somebody asks if they can help you, say yes. Have them come in and just be a companion for 2 to 3 hours while you take a break. Remember, if you're a caregiver, your ability to be calm and patient can vary from day to day. So beware of how you feel and are responding. So, is research finding a cure? No, not yet. The search continues for other blood markers to make early diagnosis easier. One such marker that's been around for some time now is apolipoprotein E4, and it's a genetic marker. If you have, as you know, we have two sets of genes, one from our father, one from our mother. And so if you have just one gene with that particular gene, there's about a 31% chance of developing Alzheimer's. If you have two genes, so you got it from both parents, the chance goes up to 60%. Now, breaking news on May 16th of 25, another test was approved for marketing, and this is a blood test that measures the ratio of two proteins that are associated with amyloid in the brain. They are, and you're going to really remember this one, I'm sure. But anyway, they're p-tau W17 and beta amyloid 1-42. So, but measuring the ratio of those can give a pretty accurate, the false positive, meaning the number of people who don't have excess amyloid that test positive is low, it's less than 5%, and the false negative is also low, less than 5%. So it's a good test for the amyloid in the brain. But remember, just like the PET scan, amyloid in the brain is a marker, but not a predictor. Other things that are being studied, and actually, this is one of the places where there's a lot of studies going on, so I don't even know what all they're looking at. But they do, lots of research is being done into genetics, genetic testing, treatment efficacy, lifestyle factors, and other factors that improve function and health. Finding the cause may one day result in prevention and a more targeted treatment. Ingrid Bergman says, getting old is like climbing a mountain. You get a little out of breath, but the view is much better. I want to mention the 14, okay, where are they? I know I have them. Anyway, there are 14 known preventative steps that I encourage everyone to take, but again, with a disclaimer that you can do everything right everything right and still have the disease. Or you can do everything wrong and not get the disease. It's just that way. But these are important things to do. So first is a plant-based diet. And if you can't give up that meat or chicken or fish, at least have 2 or 3 days a week that you don't eat the animal proteins and see what happens. The second one is exercise, and it's really important, 120 to 150 minutes every week. Does not have to be super vigorous, but it does need to be regular. I tell people if they've got a broken leg, we're going to give them some arm dumbbells to use. So honestly, this is critical. A third one, which a lot of people aren't aware of, is getting vaccinated, especially your annual flu vaccine. We know that, well, there's some theories that viruses play a role in triggering this disease. We just don't know what triggers it. We know a lot of risk factors, age, number one, which can't be changed, of course. But we don't know. We believe that inflammation does play a role, and avoiding diseases that are inflammatory, like flu, getting your pneumonia shot, getting your RSV shot. There's another whole talk on adult vaccinations, but okay. So the number 4, believe it or not, and this is a rare one. I only found one reference for this, so I think it's still being looked at. But this reference did show that a daily multivitamin, multimineral may lower your risk. It was published in the American Journal of Clinical Nutrition in March of 24, so it's pretty up to date. And it showed that supplements improve memory, especially episodic memory, but not executive function or attention. So at any rate, number 5, this is an interesting one, avoid air pollution. I don't know about you guys, but for the last week, I've been staying indoors far more than I would like to. And it's because it's been extremely oppressive. The heat, the humidity, but also the fact that all of that air is just heavy and settled, which concentrates the pollutants, is really bad for us. It really and truly is. There are a couple of apps you can get for your cell phone that tell you the daily air quality, and it's an easy thing to look at, and you might want to do that. Number 6 is protect yourself against traumatic brain injury. So what does that mean? Wear your helmet, please. Bikes, motorcycles, riding horses, playing sports. Also, avoid falls. Easy to say, but there it is. Number 7, I think, is particularly important, which is to protect your hearing. If you are mowing the lawn or on an airplane or around loud noises like a music concert, wear protective earmuffs. Earplugs don't work quite as well, okay? If you do have hearing aids, please wear them. And if you're a caregiver, make sure that they are working and turned on. Just because there's an hearing aid in someone's ear doesn't mean they're hearing. So get your hearing tested if you have questions, and really and truly wear those hearing aids. It's huge. Number 8, and the hearing aid, social connections. Feelings of isolation and loneliness for people older than 55 increase dementia rate by 49 to 55%. It's amazing what a difference that makes. And that was from the International Journal of Psychiatric Clinical Practice. All right, number 9. Also reduce your feelings of loneliness by nurturing your own mental health. It's really important that if you're having depression, anxiety, whatever it may be, that you consider therapy to get the help that you need. It makes a huge difference. Number 10 is the usual advice from your primary care doctor. Monitor your blood pressure your blood sugar, and your cholesterol. All of those add to the type of dementia called vascular dementia, which is very common. High blood sugar all by itself, not even the disease diabetes, just having a high sugar has been shown to cause cognitive impairment. Number 11, we touched on earlier, which is to get a good night's sleep. And what does that mean? 7 to 8 hours. Also, decreasing your alcohol intake is huge. Alcohol is directly toxic to the brain. It's also directly toxic to nerve cells elsewhere in the body. And again, that could be a whole lecture because the effects of alcohol are many and mostly bad. Alcohol also increases your risk for diabetes, high blood pressure, and stroke, but also your risk for falls and traumatic brain injury. Number 13, I hope everybody's done this. Stop smoking, or don't start, is even better. Number 14, and this is really interesting, again, avoid sleep medication. It's been shown to dull your cognition over time. Cognition's thinking. And it increases the risk of falls due to daytime drowsiness or falls if you get out of bed at night. So, sleeping meds really are not the way to go. Number 15, I really love, which is use your brain muscle. So, does anybody have a favorite way to do that? Raise your hand. Favorite way? Okay, lady with the glasses. Excellent. You had one. Same thing? Crossword puzzles? Excellent. Anybody else? Yes, ma'am. Reading, yes, good. What would not be an engaging mental activity? Thank you. I can't believe it. I didn't have to say it. That is exactly right. It actually zones you out. Well, there's other reasons to avoid TV, but we won't go there. Anyway, computer games, there's just lots of things, studying languages. They did one, which was actually more on motor skills, but I found it interesting, playing ping pong. Because I guess your brain has to calculate the angles that the balls come. I guess pickleball's more of a thing now, but it's similar in that way. Okay, so remember the big three, which are huge. If you are a caregiver for someone who's experiencing memory problems, three things. Number one, never argue. Never argue. There's no point to it, and it will leave bad feelings behind. It just doesn't work. Number two, be kind, be gentle. Hey, it's great to see you. How are you doing today? And number three is distract and redirect. I don't want to go to the store. Oh, those are such pretty shoes. Why don't you wear them to the store? So, we're just shifting a tiny bit, but it's almost like getting your 3-year-old to get dressed and out the door, but in a way that is respectful, because lots of these folks are not 3 and don't want to be treated as such. So on your handout, I've printed out 2 sides, and I just want to go over the first side. Shows a hotline number at the top, and I put that in bold. For those of you online, it's 1-866-232-8484. This is a helpline that's staffed with funds from the Alzheimer's Disease Foundation by licensed social workers. These are folks that really know how to get the help you need, and they can give you lots and lots of resources, practical things, support groups, and so on. The second on that same page is it time to talk? And I think by reading that, you'll get an idea. And I'm not going to read these out loud because you can do that on your own. But there is a column for notes, and the whole point of the notes is when you are seeing your doctor or your neurologist, you might want to take notes on behaviors or certain things that you're concerned about. For example, is the person neglecting their hygiene? How can you deal with that? Those are some specific things to get help with. Okay, so on the second side are a couple of things to talk about in terms of your doctor visit. And the medication list, I broke out how to get that written and how important it is. But what I didn't put down, and it is equally important, is to have that with you at all of your visits. So you take it to the dentist, you take it to the doctor, you take it to urgent care, you take it to the emergency room. The patient has a copy, the caregiver has a copy. If there's some other contact who's involved, they have copies. And it's so important to remember that your medication list is a living document. You want to update it as soon as there's any changes. It's really important. And then when you go to the doctor, you want to, again, taking notes is so helpful so that you don't forget this. If you've seen a new doctor, if you've had any hospitalizations, emergency room visits, injuries, or illnesses. Then if there's any new problems or symptoms, those definitely should come up. And finally, at the culmination of your visit, the question that you want to know or have answered for yourself is, what are the most important steps that I can take for my health? And it's a good idea to have at least one or two to give you an idea of what's next. Okay, so before I end, I'm going to give my favorite of these quotes, and this is from George Burns, which the people in this room hopefully are old enough to remember. He says, "When I was a boy, the Dead Sea was just sick." Okay, open for questions. Yes. I can talk into the microphone. Oh, sure. Yeah, I just like to see you. I'm sorry. That's so much better. You're fine right there. Mhm.
And I'm the one with the deep. So, um, on everything you said, and like a way to get those, or is that like
You want a copy of my talk? Is that what you're asking for?
yeah, the slides. I mean, when you go through,
Okay.
I mean, like
I can email it to you, but I don't know how to get it to her. Okay.
when you said, okay, I'll be in touch with you on Zoom. I want to have that right away. All those drugs. Okay, thank you. Like, I don't even see your name. Pardon?
I didn't bring my cards because I'm retired. I don't practice anymore. So my cards are kind of like stashed in a drawer.
Probably takes care of everything. And when you're on, I mean, that chat would be serious person. Now, I have had quite a few tests, and I'm waiting actually for my ratio test, the beta amyloid 4240, and a little longer because they I'm and I love that you say that it's only 5% false positive. That's pretty amazing. So, okay, I'll start with this. And you know, it is a progressive disease and for some, like, months ago, I'd walk straight in here, take a chair, I would not be stuttering, look like I should be. So mine, and after my MRI, and that's stepwise, but I have vascular dementia, even though, you know, you have STEM. So that was an interesting point. Out to have a PET scan, actually been accepted, which does not take me away from here, you know.
Absolutely. It's added information.
20th,
Mhm.
I go in, I meet, and I have tests on Friday. And I mean, it's like, I've been waiting and begging for these things. But this is the scary thing. But you have many strokes going on in your brain all the time. I mean, I've seen that on the Mayo Clinic, the Hopkins.
For vascular dementia, yeah, it's
I
thought,
mean, this is, this to me, I was serving, go to little kids, I mean, run with them upstairs, 3 hours. Hard, I don't want to, and I did working 18-hour days. Because my blood pressure was under control, but now it's not. I'm even having a hard time getting. There's best depression drugs for dementia,
yes.
but is there a best blood pressure? Because I'm on that low certain K.
There are just a few blood pressure medicines. No, I will say this. Okay. It's really important for me not to give you specific advice because that needs to come from your doctor, your care team. But here's what I will say. There's a few drugs that you want to avoid, but they're older drugs that aren't used much. Reserpine is one that used to be used a long time ago. There was one called Inderol or propranolol that definitely has mental status changes associated with it. So there are some to avoid, but not necessarily a best.
Okay. And I have a cardiologist.
Yeah, yeah.
The response is not like Kelly or
Well,
Mayo.
and what I will say is this, and that is, unfortunately, with blood pressure medicine as well, you want to start low and go slow. Because nobody wants to drop your blood pressure dramatically and have you faint on the floor and bonk your head. That would be a really bad outcome. So probably what is happening is a process, and as impatient as we are to get her done, it can take time to find the right combination that works well for your blood pressure but doesn't cause you side effects. So yeah, and then we had an online question. So would you mind? Oh, okay, go ahead. Was there somebody who had a question? I thought there was. Get an ApoE4 test. It's a blood test. You have to ask someone to order it for you. And generally, you would do that if you are concerned, if you have conditions that are concerned. I think you might do it. I don't know if insurance would cover it, so don't ask, because I don't know. I mean, I just don't. But you might do it if you had a very strong family history as well, because obviously it's a genetic test. So this would be something that would tell you what sort of genetics you have. It's for a very specific gene, and that's the name of the gene, the ApoE4. Yes. cholesterol and blood sugar. Uh-huh. So the ratio is good. They're not worried. Okay. I don't recommend worry as a rule. Yeah, well, yeah, you want to follow the advice of your physician. One thing about blood pressure in the doctor's office is it's subject to change. So let me just tell you that yesterday I went to an outpatient clinic to have an injection. It's a medication for osteoporosis. Yeah. Anyway, my blood pressure was pretty high when the nurse took it, but I had just gotten there. And you're driving, you're parking, you're filling out the form, you know how it is. So I said, wow, that's a higher number than what I'm used to. So the answer is sit quietly for at least 5 minutes, feet on the floor, not legs crossed, feet on the floor, back of the chair, not on the exam table, in a chair with a back. And that blood pressure should be closer to your regular blood pressure than the minute you get through the door, the nurse takes your blood pressure. I know that's a thing. I could never train my nurses to, but if someone's blood pressure was high or borderline, I often retook it myself because it does help to just sit quietly for 5 minutes. If you take it at home, that's also what I recommend you do. Yes, ma'am. Namenda. Uh-huh. Yeah. Right. Yeah, that's a great question. She said, if the medicines like Aricept and Namenda aren't making a difference, should you continue them? I would say, because there are a limited number of those meds, you should at least try some of the others. I mean, I think your care team would probably say so. But again, the thing that you got to remember is that at best, what we're looking to do is slow the decline. If it doesn't make any difference, then at some point it may be, you may choose, or your care team should really be in on this. You may choose, or they may choose, with your consent, of course, to stop.
This is related to the length of time on well, I guess we should check.
You want to give it adequate time to see if there's a difference, because the only way you know is by retesting. So no, I don't have a specific number, but I would say 3 months is a minimum
Okay.
to give a drug a fair chance.
All right.
Again, remember there are limited options, so you don't want to abandon something too soon. And you may have been started on a lower dose, and a higher dose might work better. So that might end up being 6 months. So you might start with 5 milligrams of Aricept and then go to 10, et cetera. So yeah.
Also, the drug, for options, nobody in lead. Lifestyle empowerment for the, yeah.
Sounds great.
Yeah.
Yeah, exercise is one of those things that lifestyle changes that people have a hard time getting themselves to do. So having a schedule or some people to do it with can be hugely helpful. Oh, yeah, hugely helpful.
I will make this my Because the exercise, I used to do triathlons like 4 years ago. I did a triathlon right before I moved back here. I lived someplace different. I have muscle wasting. Obviously.
It can, and unfortunately, some of the medications can have nausea or loss of appetite as a side effect as well. So unfortunately, yeah, that's a lot of weight to lose, and you are very thin. So that's something you would want to address, maybe with the folks at Mayo, certainly here at KU, if this is where you come regularly. So yeah, it's an important one. You're very welcome. Mm-hmm.
I'm sorry, we have a question in the chat.
It's for testing amyloid. The new test is for the presence of, well, it's two amyloid molecules, and they do a ratio of how much of one to the other. And it is highly correlated because when they studied it, they did the PET scan that with the dye, if you will, that picks up amyloid in the brain, because a regular scan can't see it, but with the dye, it can be seen. So the blood test was validated by correlation with the PET scan. But again, and I hate saying this, but I think it's important because we can get pretty hung up on test results. They are one piece of the puzzle, but the clinical picture, how you're doing, how you're functioning, how you perform on memory tests is really where the rubber meets the road. And so that is more important than any scan or blood test. And I hope that's helpful. But it's nice to have more tools. Who knows? Maybe that will become a tool for following progression of the disease. It's a lot cheaper to get a blood test than a PET scan. So, and there's lots of places you can't get a PET scan because PET scanners don't exist in, right, everywhere. So, yeah. Oh, good. Mm. 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 That's still 50 pounds, yeah. Right, right.
Don't have it, but I weigh 145 to 30. Which, so I'm investigating I'm lactose. Oh, you're lactose intolerant?
Yeah, there are powders for lactose. Yeah, yeah, yeah.
I wish that I could still get my pea protein, but, and we thank you for sharing. Thank you.
Nuts are a really good source, and they're also high in fat. Peanut butter is a great source. We're talking, for those of you online, about muscle wasting, weight loss, and how the drugs can affect the appetite. We have um, someone here who's lost a lot of weight, and another person whose husband has vascular dementia, and he has lost a lot of weight. And she was saying that a protein powder added to a morning shake has really made a difference. And we were just talking about ways to boost your protein and calorie intake, even if your appetite is not the best. Mm-hmm. Mm-hmm. Yeah. 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 And remember that resistance exercise builds muscle. So like weightlifting and calisthenics build muscle, whereas aerobic exercise like walking, swimming, cycling uh, burns calories and helps your cardiovascular health. So it's really, really important, but it doesn't really build muscle the way resistance training does. You can even get those rubber bands. Those are very handy to use, or little hand weights, that sort of thing too. Yeah, yeah. Mm-hmm. That's good for, well, he has vascular disease. So for heart health, that makes a lot of sense. But for muscle strengthening, you need the other kind of exercise too. Is there anything else on the chat? Okay, okay.
Anything else you want to?
Not for, not much.
Hello.
Get your, I said
Hi,
the last.
everyone.
Okay.
Okay, I'll switch places.
Oops, oh, I'm sorry.
Okay. Hi, everyone. Thank you so much for being here. And thank you so much for your patience and your attention online. Thank you to everyone in the room for being here and asking such great questions. I think we all learn when we can share information like this. I want to say thank you again to Karen Wheeler and to Tara for the great snacks. Now that we're on this side of this program, I'm going to go get my plates and nurture my brain. But I do want to make sure everybody in the chat has a chance to say anything else that you might want to, whether you put it in the chat. Wow, that is strong. Put it in the chat or unmute yourself. You're welcome to do that. Those of us in the room may hang out for a little bit longer in case you have more questions. You don't have to. I'm just saying we can if you'd like to. Those of you on Zoom, you're welcome to stay online on Zoom if you'd like. I will process the recording and post it later today. All of you who emailed to say you wanted a copy of Dr. Andy's handout, I've gotten those emails and I will send it to you this afternoon. I also put a link in the chat where I believe you can get the handout directly. So look in the chat for that link. And there's no way you will miss it. All right. With that being said, I'll look in the chat, make sure I didn't miss anything else. Okay, I see a question in the chat. I don't want it to be up on the screen too long because it was sent directly to me, but I got to be able to read it. And the person is asking about when her parent does not seem to recognize that he has dementia. And Dr. Andes, I'll ask if you might come back up and give us an answer to this. Do you have suggestions for talking to the doctor when someone is not wanting to recognize about having some symptoms of cognitive change? Okay.
Yeah, I think the reason that there are those columns for notes is little things in life happen and it's easy to forget. So be very specific. Oh, Dad, don't you remember you were trying to drive to church? You've been going to that church for 40 years and you got lost. You couldn't find your way and you've gone many times. So bring up a specific example. And that helps a lot. Now, Dad, if he does have memory loss, may not remember getting lost, but the doctor will know that that happened because you said it. I hope that's helpful. So take little notes of especially things that are worrisome. Like, Dad, you remember you walked out of the house and you didn't have shoes on and it was really cold? You know, stuff that just is worrisome and makes you wonder what's happening. Okay? I think it's really, really helpful to do that. And it's not like you're a super spy, but a lot of us, particularly very intelligent people, like my sister who does have dementia, can fool you if you just talk to her in a casual or social way. Because this is well known. You know, how are you doing? Oh, I'm great. Do you like where you're living? Oh, it's fun. It's wonderful. What year is it? No clue. You know, so the superficial and on the surface type conversations may not tip someone off to that there's a thinking or memory problem.
Thought we were not supposed to say no.
I think maybe that was poorly stated on my part. Thank you for correcting me. Honestly, that was good. I would say, oh, I was worried about you when.
Yeah, and I would chime in on that is that uh, asking questions is not good. Making statements works. Make a statement. It's cold outside. We don't want to go outside without shoes on, rather than asking, why did you go out without shoes on? And the other thing is, some people I've talked to and that I've learned too, is that if you're going to go to a reunion sometime, show pictures ahead of time. Don't ask questions, show pictures ahead of time so that they will be familiar with the faces they're going to see. And that's just a couple of things that, but the making statements is so much better than questions. They'll shut up on you. They won't answer.
Yeah, that's wonderful. I agree with you. And I also I want to say that going to a support group for caregivers or actually for the patient in the early stages, going to support groups for those with a similar condition can be amazing, not just for the support, feeling like you're not alone, but also tips and techniques. You know, I had a patient, oh, this was just brilliant. The problem was her dad wanted to drive and he was no longer capable of safely driving. So instead of arguing with him, what she did was have a set of car keys made that would not start the car. They would go in the ignition, but wouldn't start the car. And she just hung them where the keys always hung. And then if her dad felt like going someplace, he'd go out there, try to start the car. It didn't start. He might come in and grumble and she'd go, oh, you know what? Let's call the mechanic. And it would just drift away. But she wasn't the enforcer. So there's lots of things that are really helpful if people tend to wander at night. You can have alarm systems. I could go on and on. But that car key one, I really liked because it came from a support group. And you know, it's something I never would have thought of. It's so smart.
Yeah, there's another one on that driving that I've heard works too, is to have a law enforcement officer or the doctor tell them, hey, Bill, we don't think you ought to drive anymore. And that way they will accept that as an authority. And if they become angry about it, they're angry at that person and not at the caregiver.
Yeah,
It's another way to do it.
I've often told my patients' families, let me be the bad guy. You know, if it's time for someone, for example, to enter a memory care unit or hopefully they can go to assisted or whatever to begin with. But often I'll take that on. I'll be the bad guy and say, you know, what I'm hearing really has me worried about the safety of the home environment, you know, da da da. I think it's time we considered blah blah. And, you know, sometimes these conversations need to be repeated more than once. There are actually driving tests that you can take. They're not paid for by Medicare, but they're wonderful because they can assess someone's driving and really be, yeah, you're probably not safe to drive, or no, it looks like it's okay for a while. Yeah, anything that is sedating or stimulating is probably a bad idea. So there's lots of older antihistamines that are sedating, like Benadryl, over-the-counter sleep pills, that sort of thing. I don't recommend. And stimulating, there are fewer of these decongestants things on the market, but those can cause problems. But things like energy drinks are unbelievably awful for anybody, not just someone with dementia, but the 5-hour energy or whatever, you know, leave those things well alone. But I do recommend you make a list of any over-the-counter things that you take on a regular basis and have that as part of your med list. It should really be on there. And so, for example, I do take me personally, I take a multivitamin, multi-mineral, and it's just got so much stuff in it. I took a picture of the label so that I could share that with my doctor and not have to try to write down how many milligrams of this or that it had.
What if the person knows that they're? Oh, well, I'm just getting old.
That's a toughie, and I think that's one for your care team because everybody is a little different when it comes to that. For example, my sister initially was aware of her memory problems and would say things like, I just can't remember a thing, you know, and whatever. And we'd commiserate and go, yeah, that's got to be a bummer, you know. But as she got worse, she would argue that she didn't have a memory problem. So, for example, she has other conditions that require medications, and she refused to take those because she said, I don't have this, I don't need a medicine, etc. That's a more troublesome thing and does require intervention and follow-up. So I can't give you one blanket solve-it-all remedy. I wish I could. It's something that you know, sometimes it's a distract or reward system or whatever. I do think it's a great idea if you do have like you know, have to go through a MRI scan or something, you know, do something fun afterwards. Go out for dinner, take a walk in the park, go to a movie. Because you know what? It's no fun to lie in those scanners. It's no fun to have your blood drawn. It's no fun to go to the doctor and have them ask you 500 million questions. It's just not a good time for anybody. So do your best if you're a caregiver to sweeten it, you know, a little spoonful of sugar type action.
Hi again, everyone. Thank you so much for your energy and your questions. We're going to, I think, wrap us up for the day. Again, if you emailed me about getting the handouts, they'll be on the way later today. And the link to the recording and the handout will be in the Monday issue of the newsletter. Dr. Andes, thank you so much for sharing your expertise and your time. Those of us in the room are giving you some applause, and I can see some smiles on the Zoomers too. So thank you for that. Again, thank you to Karen Wheeler and to Tara for coming out and giving us some snacks today. We appreciate your interest in all of our programs at the ADRC. Today's the last day of July. Can you believe it? Wow. So next time we meet will be August 7th. We'll be a week into the new month. And our speaker for next Thursday, you all are going to get sick of me. It's me. I will be your speaker for next Thursday. And I am actually going to do one of the topics from the dementia training room. And some of you have been saying, oh, I didn't get to make it to the training room, or I didn't get to make it to all the topics. And so I thought very occasionally I will bring you a topic from the training room that might work well on Zoom. So next week, we are going to talk about the title of the session is Keep Moving, and how exercise is beneficial to with dementia. And so we'll see, we'll have some slides, and I may even be convinced to demonstrate some very easy, low impact exercises that will not break my leg or embarrass me. So we'll see how that comes out next Thursday. I might forget to record that one. We'll see. So stay tuned next Thursday if you want at least a laugh. And I think some good information. All right. Thank you, everybody. I'm going to keep the chat open for a little bit, see if there's anything else, and I'll let Dr. Andes know how much.
I'll see you in 2 weeks.
Oh, that's right. I didn't know if I should say it. Yes, in 2 weeks, we will have our very own Mr. Eldine Holtis as a guest speaker. And many of you know that he is very proud, deservedly so, to tell us about how he's 92 years old. And so we are going to hear some secrets, maybe some good advice about how to get to 92 from Mr. Holtis. So I'm super excited about that. And then we've got a couple other speakers lined up for the rest of August. So it'll be good times, good times. All right. So, here's the question again. I want to make sure we got it. And it is, hang on, there's a lot of things here I typed. Hang on. Okay. Is there a downloadable PDF of over-the-counter items that are contraindicated or need to be used with caution that is available? So Dr. Andes, are you aware of a resource like that? Yeah. Okay, so Dr. Andes says she's not aware of that. That sounds like something for Google and my handy social worker skills to look out for. So for the person who left that comment in the chat, I'll see what I can find out, and send me your email at myalliance@ekmumc.edu, and we'll see if we can't find an answer for you. All right. Okay. Thanks again, everyone. Have a great week. We'll see you next time. Bye-bye.